Am I audible?
Yes, sir, you are audible, sir.
Yes, sir. Good afternoon, sir.
Yeah.
Sir, shall I start the session?
Sir, सुन रहे थे ना?
Hello.
कुछ बोला? सबको कॉल कर लो. Mute actually.
ओम अज्ञानतिमिरान्धस्य ज्ञानाञ्जनशलाकया चक्षुरुन्मीलितं येन तस्मै श्री गुरुवे नमः. A very good afternoon to all the participants who have joined us for the session today. Myself, Dr. Pooja, second year KCPG scholar, Department of PG Studies in Kaya Chikitsa, Ballari. Taranath Government Ayurvedic Medical College and Hospital welcomes you all to the M. Ishwar Reddy Memorial Kaya Chikitsa Webinar Series 2021 on the topic Raj Yakshma in the memory of late Srinivas Acharya ji. We Taranath Government Ayurvedic Medical College and Hospital are blessed with the Swargya Pandit Taranatji's name. As we know, tuberculosis is a potential high communicable disease with a high mortality rate. Drug reaction and the adverse drug effect is one of the major causes for the searching alternate solution and understanding the concept of Vyadhi and the Chikitsa. So keeping that in mind, on the occasion of World Tuberculosis Week, we Department of PG Studies in Kai Chikitsa decided to conduct a webinar series. So welcome you all for the third session of the webinar series, and today's guest speaker, a very well-renowned teacher and the practitioner, Dr. M Gopikrishna sir. It's my privilege to introduce you, sir. Sir had pursued his BMS degree from SDM College of Ayurveda, Udupi, Mangalore University, and the secured third rank in the university. Sir pursued his MD in the year 2004 from the SDM College of Ayurveda, Udupi, Rajiv Gandhi University. Sir has done CCN, that is a clinical nutrition course from BLCC, New Delhi. Sir has done CCH Pediatrics in the year 2010 from the Institute of Health Science, Mumbai. Sir have done CGO in Gynecology and the Obstetrics in the year 2010 from the Institute of Health Science, Mumbai. Sir's teaching experience, theory as well as the practical class to the BMS student at the Bapuji Ayurvedic Medical College, Chalkeri since 2004 to 2009. Theory, practical, and in research with the postgraduates since 2010 till date, and SJG Ayurvedic Medical College and the Postgraduate Research Center, Koppal, Karnataka. Sir's practical experience in all kind of the Ayurvedic pharmaceutical preparations like Potali, Parpati, Khalvia, Kupi, and the Taila. Industrial-based research, experiment in the formulating new Ayurvedic preparation in the cosmetic Ayur manuals, experience in the Marma Chikitsa and in practice in day-to-day clinical practice in the various disorders. Sir has personally prepared around 250 Ayurvedic preparations. Sir has attended and presented a number of papers at the international and the national seminar like Standardization, a Boon or the Curse, Introspective Analysis of the Metallic Bhasma, Concept of the Samskaras in Ayurveda, Metallurgical Background behind the concept of Sattvapatana, Pharmaceutical Approach behind the Chaturvida Parada Rasayana. Thank you, sir. Now I request our beloved HOD, Dr. Madhav Digavi, sir, to welcome you, sir. Thank you.
Good afternoon, sir.
Namaste, sir.
So it gives me an immense pleasure to welcome Dr. M Gopikrishna, Professor and Head of the Department of PG Studies in Rasashastra, and a well-known Rasachikitsaka, Rasavaidya, who is contributing much to the academics of Ayurveda. And whenever we request him on behalf of Tarnath College, he always gives positive response. He is virtually practicing many Potali Kalpas and Rasakalpas in day-to-day practice in chronic diseases as well as challenging disorders. Today we are in the session of a series of webinar in loving memory of Dr. M. Reddy and belated soul, departed soul, Dr. G. Srinivasa Acharya. In their loving memory, we are celebrating World Tuberculosis Week. In that continuation, I welcome Dr. M. Gopikrishna personally and on behalf of the administration and our beloved principal, Dr. Syed Attar Fatima Madam, for today's webinar. He has his own contribution to respiratory disease management, wherein it can be taken for post-tuberculosis sequelae or preventive rasayanas, and also in space-occupying lesions of respiratory system, so that immunologically we are able to connect the J.G.A.M.C. Chikitsa in current practice. Without taking much of the time, I welcome Dr. Gopikrishna sir once again for this webinar. Thank you, sir.
Thank you, sir. Thank you very much. So good afternoon to one and all. Is it clear? So today we'll be discussing with the topic about the Rasoushadhis in respiratory disorders. We'll try to go with to see what are the answers for dealing few of the respiratory conditions and what does Rasoushadhis speak about it. And in case if we can go with sharing few of my ideas and clinical experiences in treating the disorders of respiratory system and the way how I go in dealing with it. So before I start with the presentation, I would like to acknowledge the J.G.A.M.C. College at Bellary, always a very friendly and supportive team from the Department of Kaya Chikitsa, even Dr. Madhav Tigavi sir, for making this to happen. This is indeed a great event for the reason both are the excellent personalities, Dr. Ishwar Reddy sir and also Dr. G.S. Acharya sir. Fortunately, I had lots of experiences to be shared because I have learned many things from Ishwar Reddy sir as well, if not as a direct student, but from outside. Lots of things we have discussed throughout, especially regarding the practical aspects. And of course, Dr. Srinivas Acharya sir is a great personality and a great teacher indeed. And I was his student almost in the whole of my undergraduation and post-graduation. And it's very painful to see that both of them are not between us. But still, let me say one thing, their knowledge and their implications are been very well evident in thousands and lakhs of students, which will make them to become more and more immortal. So with this salutation to both the great personalities, the departed souls, I would like to step into the topic of Rasoushadhis respiratory disorders. And very important to speak about is this has become one of the most priority in today's practice, just because of the reason of the pandemic issues which is going on around, which everyone is facing, the globalist scenario. So once I speak about the respiratory disorders, it includes most of the clinical conditions. Might be it is tubercular, post-tubercular managements, or it could be something like a post-COVID management, or the general disorders related to the respiratory system. And definitely it's a very, very wide chapter to discuss about each and every aspect of respiratory disorder and relating it with that of the Rasoushadhis. Possibly the session might extend to 6 hours plus if we go into the details. Instead, let me converge to the main points which I would like to discuss today, specifically on the prescriptions or the recipes for the respiratory disorders. So to step into the topic, salutation to the God. Without him, nothing would have been possible. And with his blessings, we are able to do at least few things, which is making our science to be recognized even in this 21st century. The first thing which we speak about the clinical conditions, the first thing which we discuss about the Pranavashrotas. Why? Many times to keep in mind, what we are discussing today is about the tubercular management, the post-tubercular management, or the respiratory illnesses. Pertaining to this particular issue, the one which is very much specific to the concerned aspect of the concerned shrotas, as per Ayurveda, it is the Pranavashrotas. And this particular Pranavashrotas is quite an important thing in day-to-day practice, and everyone would have been identified it, recognized it, or felt it, at least in this past 1 year, about the respiratory illness, what's happening to the whole globe. So this is importance of Pranavashrotas. And the most important phenomenon to start out, once we speak about the Pranavashrotas as such, is if not, like it's not alone like a tubercular patient, because It's not like every person would have been experienced in treating all the sorts of tubercular managements or post-tubercular managements, because many times it has been, most of the times, or almost always nowadays, it has been to be referred to the government hospitals. So the private practitioners would have seldom seen the tubercular managements as such in their practice. But still, there are many things which are to be concerned to understand on the grounds of Ayurveda, because all these conditions fall into the pranavashrutas. The COVID management which has happened from past 1 year, it's almost to that of a Rajekshma like of a presentation. The patient is having a sort of a dyspneic, is landing up into multiple complications, multiple systemic disorders. He is landing up into GT presentation, skin presentation, respiratory illness, infective pathologies, decreased saturations of oxygen, and also he's boosting up with something like end organ failure or multiple organ failure. IL-6 is severely raised, and most of the times, to be very disgraceful about this particular disorder is people are dying because of the cardiac arrest. Why? Ayurveda has an answer for that. It's not like just a nutritional deficiency during the period of COVID which made them to land up into that cardiac illness. It is because of the shrotas which has been involved. Pranava shrotas moola is hridaya. So in any of the patients suffering from the COVID is an example. COVID is a bracket wherein we are naming it as an example. Hello? Hello? Yeah. No. Just this is the first slide. Pranava shrotas. Once we are seeing any of such illnesses, we are able to see like the disorders which is related to the pranava shrotas. The hridaya has been affected. So once the hridaya is being affected, the possibility like the conditions wherein the person had landed up into the illnesses of these kinds will have a cardiac arrest. What makes it? Because the pranava shrotasamulam, it is hridaya dashadamanyaha. So even though the person is not being treated properly, or in case it's a chronic illness or a bahudoshavasta, a drastic illness which has caused the person to become more and more deteriorative, it affects the hridaya, which is a mula sthana. So whenever the shrotas has been insulted for a particular issue or a chronic issue or a sort of a severe damage to the shrotas, the root is affected. The root or the mula sthana is the hridaya. Why I have given this example? Because everyone of us have seen thousands and lakhs of cases of COVID in the past 1 year. That's the reason I have given the example of COVID. The similar pathology happens with every respiratory illness. Even though the person is suffering from tuberculosis, the person is suffering from interstitial lung disease, the person is suffering from emphysema, the person is suffering from bronchiectasis or any of such conditions. Why this happens? Because of the chronicity of the illness, what happens? The dirgha kalina vyadhis, or whenever you have the chronicity of the illnesses, then what's happening there? Vata prakopa happens. So once you have the vata prakopa, it has to show its prabhava on that particular shrotas. The vata has to show that prabhava on the shrotas. And how is it showing in any of these illnesses? Might be it is post-COVID, post-tubercular, or it is emphysema, bronchiectasis, or interstitial lung disease. The very common phenomenon which happens in all these 5 types of chronic respiratory illnesses. There are many disorders, but these are few which I have given as an example, is the lung fibrosis. The elasticity of the lungs has been lost, which has made it to turn into fibrotic, which is again a presentation of vata. So what is the prime concept which we need to do here whenever you have the illness of the pranava shrotas is initially, before it lands up into the fibrosis, try to say that you give him with some vata shamana dravya, because that vata, in case if it is going to get aggravated, it's going to totally spoil the show. it will definitely make a many times an irreversible organic change there in the form of lung fibrosis. And whenever you have this lung fibrosis, the person breathing capacity is being affected once for all, because the elasticity of the tissue is lost, which has its impact on multiple organs of the body. It will have its impact on multiple organs of the body. It will show its worst pathologies on various organs. It will show lots of complications on multiple organs. Many times, let me say you, the first organ which has been very commonly affected is the heart, and also later on or eventually is the brain and the liver. So these are the prime organs which are seriously connected with the respiration. It doesn't mean like the other organs are not affected. Most of the organs are affected because it's one of the main respiratory center, but still cardia is very chiefly affected. That's the reason why pranava shrotasa moolam, it is hridaya dashadamanya. So let us see the reference what Charaka and Sushruta has given about it. Both of them accepted hridaya as the moola. Of course, Charaka has said like the Mahashrotas, which has been involved, whereas Sushruta has included Rasavahi Dhamanis. So here what's happening is, in case if you're going to take Mahashrotas as in case if it is Koshta, then much of the disorders of the hepatic or the intestines or anything will have its impact on the heart. Similarly, it is a pranava shrotas, so it is related to the organs like that of the respiratory system, will have its impact on the heart. This is the reason why many of the respiratory illnesses, like patients in case, most of you would have seen the COVID cases, there is a drastic fall of appetite. There is a drastic fall of an appetite in the patient, which makes him not to eat food. It becomes, it might be, the appetite is normal sometimes, but it is anorexia nervosa. It's anorexia wherein the person is unable to eat. Most of the people starve. They lose their weight. Even though they suffer from some 10 days or 14 days of COVID, they had suffocated a lot because it has its effect on the shrotas, that is the mahashrotas or the coaster. So in these conditions, considering like normally what we do, he's deteriorating, come on, let him dump him with lots and lots of oily food. We give him something wherein the emaciation is lost. No, that's not a right method of how to treat the patients of respiratory system, especially the chronic respiratory system or something like post-tubercular management or either of things. It should be rasayana and vatahara substance. It should be rasayana and also it should be vatahara. And let me tell you, the best drug which I can protocol here for such conditions is the Gauri Pashana. Gauri Pashana is a Rut Bhalyakara and it is one of the Uttama Rasayana. It is Uttama Rasayana. In case if you would like to know some alternative, the next alternative is the Manashila. Manashila is also one of the Uttama Rasayana there, and also it is Uttama Vata Shamana. I'm worried about to give the arsenic preparations because many people are worried about the arsenic components today. They're considering like might be the pitta of the person is raised because during the illness, like either it is tubercular or emphysematous or COVID, any of the conditions, you have the patient being presented like jwara. So whenever the patient is having fever, people scared to give arsenic preparations considering like it can be pitta prakopa. So further it can lead to the jwara samprapti, and many times this arsenic can cause some ruptures in the vessels because of ushnata and tikshnata of the drug, and it itself will cause multiple hemorrhages. But in case if you can titrate it as per the patient condition and administer it, you will not enroll any of the complications clinically, and it will be a sure shot to your patient. Post-COVID management, possibly we have hundreds of patients where we have treated, wherein the respiratory distress is totally vanished. The person are back to the normal. So you need to titre, might be it is Gauri Pashana, Manashila. The third option from the arsenic component is the Haratala. Either of the components can be given, no doubt. It is excellent. But still, the person is somewhere nearing to the Pitta Prakriti, or the person was suffering from very high grades of fever, and or the Vaidya has been scared of giving an arsenic prescriptions to the patients. In those conditions, I might not compel you to go with the Gauri Pashan or Manashila, the next alternative is the Abraka. Abraka is very safe and it can be very deliberately given to the patient, and it is very, very much beneficial to be adopted. It can definitely be given to the patient because it is also Rudhya and also it is Kasa Shwasagna. So it is also good for the Pranavashrotas. It is also good for the Rudhya. So because of these reasons, we are administering them with that of Abrakavasma. Rasavahi dhamanis, as per the Shushruta, is being affected. Even in Rasavashrotas involvement, when you see the Dushti Lakshana, you find all these complaints as Aruchi, and also you have something like Mandagni, everything, which is again related to the Koshta there. It is being reflected again in the Koshta. So again, in that way, you need to consider the drug which can act on Kosta, which can act on Rasavahi dhamanis or the Rasavashrotas, and also the Rudhya. And magically, to speak about even the Rasavaha Shrotasa Moolam, it is again Rudhya. So on that grounds, try to consider like the patient should be given some cardiac tonics, so that even though the person is being ill to a moderate extent today, he is going to become to the worst position by tomorrow or in next few days. Try to see that you control the vata initially in the patient so that he doesn't land up into complications like very commonly seen in the post-tubercular managements is the lung fibrosis. Many times you have the caseating lesions. You have multiple caseating lesions, multiple patches in the lungs, which has been seen during the tuberculosis. He's been very well balanced with the drugs like that of Makaradwaja. You have the components we have nowadays. We are not supposed to treat that easily, but when we were students around 20 years ago, we used to have the tuberculosis patients to the hospitals there, wherein it was being very well treated with Makaradwaja. Siddha Makaradwaja or plain Makaradwaja is also sufficient many times to the patient. We have seen certain cases wherein we had AFB triple positive turn to 2+ in 1 week and 1+ in second week. So within every week of administration, the decrease in the AFB positive cases was being observed in the patients. So this advantage is always there for us. So we had some restrictions for the treatment of certain disorders of those kinds, like tuberculosis or the COVID management. But the post-tubercular management or the post-COVID management is definitely, it's a platter for us. Yeah, we are going to just dominate in the conditions of either of these illnesses, and they're going to definitely be very supportive because you have a tremendous response in the patient. The drugs like either it is Abraka or Gauri Pashana is one such composition which has its action on multiple level, and it is going to show a beautiful set of treatment aura in the patient. So whenever you have the case suffering from a very recent onset of any of the conditions, like might be it is tuberculosis or any of the respiratory illness, might be you might have some Kasa Shwasagana set of drugs depending on the clinical presentation of the patient. Might be you give them with some Narde Lakshmi Vilas Ras, you give them with Shwasakutar Ras, might be you give them with Shitamshu Ras or Haridra Khanda or anything, any of the prescriptions of whichever is suited for the particular patient. But in case if the condition is going to become Bahudoshavastha or it's a drastic illness, or in case if it's going to happen as a Dirgha Kalina Vyadhi, where the chronicity of the illness has been observed, in either of these conditions, we are supposed to give them with the cardiac tonics or the Rasayana set of drugs or Ojo Vardhana set of drugs. They are the only things which can make the patient to survive, or else the patient will definitely land up into complications. Many times I have seen the patients suffering from interstitial lung disease. Post-tuberculosis, they land up into lung fibrosis, which lands up into interstitial lung disease, which lands up into cardiac arrest, and the patient will die. So this is a sequelae of what happens in the series of illnesses during the Pranavashroto Vyadhi. So whenever you want to see that you want to avoid of such illnesses in the patient, you need to treat him with Vatahara, Rasayana set of drugs, and you are happy, but you are having a bit of fear in your mind, like might be the Gauri Pashan or Manashila might cause some problem to your patient. So to be on the safer side, you can even administer to the patient with either you want to give the drugs like Mallagarbha Putali or Mallasindura, and you are feared about giving the arsenic prescriptions, to that you mix up some small quantities of pravala pishti and give it to the patient. Because even the pravala pishti is very good kasa shvasagna, and also pravala pishti is a very good pitta shamana. The pitta which is might be aggravated because of the arsenic compounds will be controlled well by administering along with pravala. So on that grounds, mix malla sindura along with pravala pishti and give it to the patient. The anapanam could be as per the patient's condition. If he's still having lots of breathlessness, then somasava could be the choice. In case if the patient is of allergic bronchitis, chronic allergic bronchitis, might be it is something like a clinical presentation of bronchiectasis. Bronchiectasis is one such condition wherein the patient is not very happily treatable. He just goes on changing the doctors because he's not addressed totally for a long time. He comes to you and he gets treated for some time. He is not satisfied. After some 6 months or a trial with you, he goes to the next doctor. Again, he takes a trial there and again he comes back to you. But definitely, Ayurveda can really make lots of wonders with those patients, because if at all some management is being possible, it's really through Ayurveda, wherein we can give very good improvement to those patients who are suffering from the conditions or the chronicity of the respiratory illnesses, as you see in case of emphysema or in case of bronchiectasis, which is also a complication of tuberculosis most of the times. So on this grounds, let us run to the next slide. These are the Shroto Dushti Lakshanas of the Pranava Shrotas, wherein you try to see the Dushti Lakshanas are very much related to that of the respiratory illnesses. I don't want to literally go into the descriptions of the Shrotas and other related anatomical or physiological aspects. Please do refer from the references which has been quoted over there on the slide. These are the symptoms, and based on these symptoms, we have to plan up the treatment. We need to plan up the treatment so that the patient will not have any of the complications. The Chikitsa Sutra, as explained by Charaka Vimanasthana, 5th chapter and 26 to 29 shloka, is about the Shwasahara Chikitsa. So whenever you have the patient suffering from Shwasa-like presentation, the respiratory illness, might be it is because of Rajakshma, might be it is because of the Shwasa Vyadhi, or might be it is because of some other illnesses like the carcinoma of the lungs or any of such conditions. Still, I say these drugs will act wonderful. It is because of Abraka, Vaikranta, Shilajatu, Gandhaka, Haratala, Manashila, Rasanjana, Gauri Pashana, Swarna, Tamra, Kantaloha, Vanga, Yashada, Mukta Shukti, Panna, Neelam, Dugda Pashana, Godanti, Shankha, Tankana, Ballataka, Bhang, Vishatinduka, and Vatsanava. The first column is about the drug, the second one is about the classical reference from the textbook, the third one is the chapter number, and the fourth one is the shloka number. So this is how the presentation goes with, and it is very much useful in many of the conditions. Let us see what happens with the Rasoushadhis, because even the patient suffering from the disorders of the Rasoushadhis can also land up into Shwasakasa, because the Rasayana properties meet very much essential for the patients. So Rasavashrotas, again it is Hridaya and Dashadhamanis. It is as per Charaka Vimanasthana, whereas Sushruta considers Hridaya and Rasavahi Dhamanis. So the Mula Sthana is almost the same between the Pranavashrotas and the Rasavashrotas. It is something like two branches of the same trunk. So this is the reason why the patient is suffering from the respiratory illness tend to land up into the disorders of the Rasavashrotas. And in case if it is being addressed well, that is fine, or else the patient is going to deteriorate in the form of either urakshata or emaciation, or what you called it as kshaya. The patient lands up into kshaya vyadhi, and he is going to become totally emaciated, and the rasayana in the person is being deteriorated. This is what is being seen in the modern textbooks. Like when you observe the patient who is having the chronic respiratory illness, might be it's a patient of emphysema or post-tubercular management, you find like the sunken eye and also the post-clavicular region. It is very much evident to have the clinical setup. Hello? Yeah. No, I'm going slowly. What are you seeing now? It's not Rasavashrotas there, is it? Oh, why? Shall I shall I go for stop sharing and again re-go?
Hello, sir.
Yeah, is it fine?
Sir, yes. Change the slides, sir. Try changing the slides, sir, please.
Yes, sir.
Is it
Sir,
okay?
yes.
Yes,
Now
sir.
it's changing, sir.
Yeah. So Rasavashrotas, which we were discussing, wherein you have the Rasavashrotas Mula is again Rasavahi Damanis, Rudehan Dashadamanis. Shroto Tushti Lakshanas, again you find all these things. In case if you read the shloka and try to see the patient of in the COVID ward, you find him with all these presentations. You have him with Ashratha, Aruchi, Asyavairasya, Arasagnatha, Rullasa, Gauravam, Chandra, Angamarda, Jwara, Tama, Pandu, Shrodhorodha, Klaibhya, Angasada, Krushangata, Nasho Agni, Ayatakalam Valayapalitani cha. So Rasa Pradoshaja Roga. This is Charaka Sutra. You find all these features seen in the patient suffering from COVID. Forget about the COVID, you find all these presentations observed even in the patients who are being suffering from chronic respiratory illness. All the patients have the conditions like they land up into the chronic respiratory illness. You find the sunken eye, you find the postclavicular notch, you find the patient suffering from excited face and also the pigeon chest in the respiratory disorders. And you find all these illnesses, it's only because of the rasayana property of the person is being lost because of the consistent respiratory illness which the patient is suffering from, which makes him to land up into grave complications. So the treatment which has been explained as per the textbook is the Langhana, Lagu Ahara and Viharas. You can see here on the slide, it is the Twag Dosha Shamana. Twag Dosha, many times we consider as Rasava Shrotas. And frankly to speak, whenever you have the Rasava Shrotas involved, you find the patient landing up into the skin disorders as well. The Twagga dosha, it relates to the Rasadhatu and also to the skin manifestations. But anyway, Twag dosha Shamana, you have the drugs like that of Shilajatu, Tutta, Mrudhara, Shringa and Gomeda. Rasayana is very important. Either it is a respiratory illness, either you consider it as a pranavashrotas or it is a case of rasavashrotas. Rasayana set of drugs is very important, or else the patient is definite to land up into the vata prakopa lakshanas and is going to land up into lung fibrosis. Body emaciation because of the undernutrition or the nutritional values or rasagnata, whatever he had during the illness, might be re-established by giving a nutritious diet. But the rasayana property is very much essential to see that his cardiac stability is being seen. He doesn't land up into the ojakshaya. Or else sarva dhatukshaya, this becomes a pratilomakshaya, which causes the ojakshaya, and ultimately it causes the cardiac arrest because of the ojakshaya. The person is going to die. This is what happens in most of the patients with severe debility of the respiratory illness. They'll die because of the cardiac arrest or respiratory and cardiac arrest, both together. And this is a very common phenomenon in most of the patients who are suffering from the respiratory illnesses. So you have the set of drugs like Makshika, Vimala, Shilajatu, Tutta, Gandhaka, Haratala, Manashila, Rasanjana, Nilanjana, Kankushta, Kingula, Swarna, Rajata, Kantaloha, Vanga, Manikya, Vajra, Rajavarta, Suryakanta, Balataka, Vatsanaba, Vaikranta, Makshika, and Manashila. They are said to be the best varieties. Similarly, for Tandra, usually in my clinic like this, what I do is take for any of the people who are suffering from any of such psychosomatic disorders with a regular Shirodhara which has been performed. To them, what I do is I just add up some of the Rasoushadhis which has been very much related as per Ayurveda over the forehead like this and start doing the similar treatments which has been done, which finds an excellent response in the patient. Similarly, Shroto Moola Chikitsa, never forget the cardiac drugs. So as I said already, Gauri Pashana was my choice. The first choice of drug was Gauri Pashana because I have considered the reference from Rasatarangini 11th chapter 143rd shloka. And also I need to consider the Vishatinduka, which is also a cardiac tonic. So this particular composition makes the drug to have a best combination for the respiratory illness, and it doesn't make the person to land up into the cardiac disorders. The other drugs are supportive. I don't say the other drugs are not supportive, but still Gauri Pashana is the best drug which can be given in most of such conditions. The Rudgati, Nadi, the Manigati, or the Mandakara, in case if you have the patient suffering from trachycardia like presentations, then Ahifeina is a drug of choice nowadays, in case if you can procure Ahifeina, because it's a banned drug. But anyway, Hridaya Rogahara, the patient landing up into the cardiac complications because of the chronicity of the illnesses of the respiratory system. During the respiratory illness, we are supposed to start this, not after the patient lands up into the cardiac illness. You have a patient who is very regularly visiting you from few months or years, possibly with some respiratory illness, might be a simple allergic rhinitis or allergic bronchitis, anything. But still, I say you add some small quantities of some cardiac tonics to the patient, or else he is going to all of a sudden deteriorate one day because of the cardiac arrest, because his respiratory system is already in an insult. You need to go with Makshika, Tutta, Navasadara, Swarna, Rajata, Kantaloha, Mukta Shukti, Vajra, Pairojaka, Dukta Pashana, and Tankana. Similarly, in case if the patient is having Rutshulahara, is having cardiac pain as such, then you give him with Shilajatu, Tutta, and Gauri Pashana. Many times I will say, when you sit in your clinics, the patient comes to you literally with these words. He speaks about, I'm having some chest pain. But you go for any of the investigations, like might be it's a TMT, or you go for any of the investigations to the patient, it is still fine. 2D echo is normal, ejection factor is normal, but he says of Rutshula. He speaks about the Rutshula to the doctor. So whenever he complains of Rutshula, be flexible enough to prescribe the drugs like Shilajatu, Tutta, or the drugs like Gauri Pashana as per Rasatarangini, Rasaratna Samuchara of the textbooks, which can be a boon to the patient. Similarly, you don't want to give the single drugs. There are certain set of formulations for the Rudroga, which can also be given to the patient in case if they are suffering. People ask me, sir, Mrityunjaya Rasa is being given for the disorders of Jwara. Why is that you are giving in the disorders of respiratory system? Because whenever I have a patient with allergic rhinitis, allergic bronchitis, or even in the case of bronchiectasis, I try to give them with that of Mrityunjaya Rasa and Arogyavardhini. Why? Just because of the reason it removes the ama, which is in the chronicity. Also, many times you have ama in the Lina dosha state, and also you have many of the conditions wherein it has been related to the shrotasis, like the mahashrotas, which has been addressed well by the drugs like Arogyavardhini. So you need to consider the cardia, you need to consider the mahashrotas, you need to consider them to understand the disorders of the respiratory system. Similarly, you have the drugs like that of the Prabhakaravati, Nagarjuna Praras, Hridayaranavarasa, Kankainavati, Hemagarbha, and the Pistis. So these are few of the combinations which can be given to the patients. Even though they are with the respiratory system, you need to give them in case if the disorders are of chronic in origin. Shroto Dushti Chikitsa, in case it's the patient suffering from Aruchi, as you see in case of Rasava Shroto Dushti, then you need to prescribe him with Abraka Makshik or Vimala. In case if it is Rullasa, give him with Hingula. Jwaragna, this is very commonly seen because patients are suffering from the respiratory illness, the phlegm gets accumulated sometimes because of the infective pathologies. As you see in case of COVID, the Jwaragna set of drugs is mandate. because it's going to affect the Anavashrotas, because the Mahashrotas is the Moolasthana, and once it has been affected, the Ama gets aggravated very drastically, and once the Ama is being aggravated, one of the very common disorder which has been framed by Ama in the GIT is the Jwara. You need to read the Jwara Samprapti for that to understand this concept, because I'm telling precursor or prior to the Jwara Samprapti, what's happening in the body and where you have to start with this set of drugs to the patients suffering from the respiratory illness. So any patient suffering from the respiratory illness tend to land up into the Jwara or the Jwara clinical presentations. We need to give them the Jwaragna set of drugs like that of Abraka, Vaikranta, Vimala, Shilajatu, Kasisa, Spatika, Haratala, Manashila, Kampilaka, Hingula, Rajata, Tamra, Kantaloha, Panna, Chandrakanta, Spatikamani, Dugdha Pashana, Godanti, Dattura, Jayapala, Bhanga, and Vatsanaba. So these drugs are to be given to the patients whenever they are suffering from Jwara. Similarly, Pandu is also a presentation. So this is how one disease to the next disease is landing up. So even though the patient is suffering from the disorders of the respiratory system, you find many times it is Pandu presentation. You have the patient suffering from erythrocytopenia. He lands up into the respiratory distress. A patient with a respiratory distress lands up into erythrocytopenia. He lands up into anemic conditions. So these complications are being seen wherein the clinical presentation of Pandu is observed in them. So whenever you have this clinical presentation of Pandu observed in the respiratory system, then we try to prescribe them with that of the drugs like Abraka, Vaikranta, Makshika, Vimala, Shilajatu, Karpura Shilajatu, Kasisa. We also give them with that of the Tamra, Swarna, Kantaloha, Mandura, and Vanga. Also, we have the drugs like Vanga, Jasada, Pittala, Panna, Shrotanjana, Kampilaka, Hingula, Rajata, Tamra, Kantaloha, Mandura, Vartaloha, Vaidurya, Rajavarta, Chandrakanta, Spatikamani, Dugdha Pashana, Katika. In case if you have the Shroto Rodha, then Sakkocha Karanadinam, Balakrit set of drugs you have like that of Tutta, Kasisa, Spatikan, Bruddharashanga. Clybia is a disorder of the Rasavashrotas as per Ayurveda. So Vajra is being indicated for Clybiata. Similarly, the Agnimandya, in case if the person is suffering from Agnimandya, being the disorders of the Rasavashrotas, which is making them to land up into respiratory illness, then the patient is supposed to be administered with the drugs like that of Abraka, Vaikranta, Makshika, Shilajatu, Gandhaka, Manashila, Gauri Pashana, Navasadara, Varatika, Hingula, and Rajata. Similarly, these are the set of drugs for Agnimandhyahara. Let us try to see with the conditions or the treatment protocols for the Rajakshma or Urakshata or the Kshina Rogas. So whenever you have a patient suffering from Rajakshma or Urakshata or the Kshina Roga, the Vyadhi Prathyanikam could be Deepana, Shroto Shodhana, Bhalya, and Brahmana. See, always one thing you need to keep in mind is whenever the respiratory illness lands up or sets in, many of the times the patient lands up into the Kshatakshina, so or Urakshata. It is because not of the external stabbing or injury, it is because of the internal stabbing by the doshas. And this is going to insult the body, and this is the reason why you have caseating lesions in the lungs. Many times you have multiple patches in the lungs with infective spots, and all of these things can be very well addressed with the drugs like that of Sarveshwara Parpati. In case if we can give to such patients with that of the Sarveshwara Parpati, you find an excellent response in the patients suffering from such illnesses of infective pathology, specifically to Vata and Kapha, most of the times. Vyadhi Prathyanikam, Deepanam, Shroto Shodhanam, Bhalya and Brahmana, Mukhyaushadhis, Bala, Shrifala, Kusumam, Amrakam, Swarnam, and Kushmanda. Abhyantara Shamanaushadhis, Sahasaja Rajakshma and Urakshata, wherein we give as Laksha Mishrana with Vasavaleha, or we give Amruta Prasha with Dugdham. Then in case if we have the patient suffering from Vishamashanaja Rajakshma, then we give them with that of the Swarna Vasantha with Dugdham. or Drakshasava with Jalam as Anupanam. Vega Avarodhaja Rajekshma. Chaturbujakalpa with Dugdha on the Chavanaprash as an Anupanam. Chaturmukharasa with Brahmi Prasha can be given. Kshayaja Rajekshma or the Kshina Rogi, give him with that of the Lakshmi Vilasaras with Dugdam. Then we give him with the Vanga Mishrana with Dugdam, Shri Phala Kusumavati with Dugdam, or Bala Pottali with Kshira. Similarly, Panchakarmopachara, Vamanan Virechana, depending on the feasibility of the patient's doshic levels. Bahashamanopachara Snehanam, there we give this that of the Bala Chandanam, Lakshadi Thailam, Bala Chandan Lakshadi Thailam, Sugandha Thailam, Patya Patya Rogochitam. Whatever is the patient condition, according to that, you can go with the Patya and Apatya. Similarly, in case if you have a patient suffering from Kasa presentation, he is having only cough. In such patients, whoever are been suffering from the Kasa presentation, Vyadhi Pratyanikam is a Snehana, Swedhana, and Shamana. Mukhya Aushadhis could be something like Vasa, Mrigashringa, Eshti, and Parisha. Abhyantara Shamana Aushadhi. In case if it is Vataja, then we give them with that of Vata Kasa Haralepa. In case it is Twagbuti, it is Mukadharana with the Kanda Sharkara. In case if it is Pittaja involvement, Suta Shekara, Mishrana with Vasa Valeha, Drakshasava with Jala. In case if it is Kafaja, then we give them with that of the Rasa Sindhuram, Mishrana with that of Madhu and Ardraka, Hema Prasindura and Vasa Hingulam can be given to the patients based on the Doshik criteria. In case if the patient is from Kshayata, in such conditions of the Kshataja, Laksha Mishrana with Vasavaleha or Chavanaprash with that of Dugdham is very ideal. My choice could be many times here with the Siddhamaka Dvaja or Sarveshwara Parpati, which can act excellently to all these patients. And in case if it is a Kshayaja, then Vanga Mishrana with Madhu, Chavanaprash with Dugdham, Lakshmi Vilasaras with Vasavaleha. Panchakarmopachara, Vamana Virechana, Dashamola Niruha, Eranda Taila, Yoga Anuvasana Basti. Baheshamanoshadhis, Snehanam with Devadaru Tailam, Swedanam with Upanaha and Bhashpanaha. So Patya Patyam, Rogochitam. So in case if you don't want to do any of such homeworks, then here you have a ready protocol. In case if you have a patient suffering from Kasa, the drugs of these kinds can be given to the patients like that of Abraka Vaikranta Makshika. Sorry, Manashila. They can be just go through the textbook. They're directly from the textbooks. Similarly, these are the drugs like Pravada, Neela, Dugdha Pashan and all. And in case if it is Shwasa Chikitsa, then we need to go for the Vyadhi Pratyanikam as Snehanam, Svedhanam, Vamanam and Shamanam. In case if it is Mukhyoshadhis, Arka, Datura, Malla, Amrakam, Pippali, Maricha and Haratala could be prescribed. Abhyantara Shamanaushadhi, Mahashwasa or Urdhva Shwasa, Hemabra Rasa Sinduram with Madhu and Tulasi, Chinna Shwasa and Tamaka Shwasa, Sleshmantaka Mishrana with Madhu, Shungahara Rasa, Mallanaga Mishrana, Dashamula Rishta, Haramala Vasanta. So these are few of the combinations which can be given to the patients. Bahu Kafavasta, in case the patient is suffering from Bahu Kafavasta, then give him with that of the Chaturbhuja Kalpas with Madhu and Pipali, Sleshmantaka Mishrana with Madhu, Shwasa Kuthara Mishrana with Madhu, Kanakasava. And in case if it is Pratamaka and Santamaka, Suta Shekara Mishrana with Vasavaleha, or the drugs like that of Shwasa Kuthara Mishrana can be given to the patient. Jirna Vega, Swarna Vasant with the Chavanaprash and Dugdha, Tivra Vega with that of the Shleshmantaka Rasa with Madhu, Chaturbhuja Mishrana with Madhu, or Kankayanavati or Kankayana the Mishrana with the Bharangyadi Avaleha can be given in the patients with that of Tivra Vega. You have many times the patient with this condition as a Tivra Vega. He lands up into very severe conditions of Tivra Vegas. Mahahika or Gambira Hika, you have the Hemasutha Shekhara Rasa. Yamalahika, you need to give them with that of the Mayura Picha Masi along with Madhu and Chaturbija, Chandra Bija Jalam. Shudra and Annajahika, Trifalati Mishrana with Madhu. Panchakarmopachara, Vamana, Vireshana, Shwasakuthara Niroha Shwasakuthara Nasya can be given to the patient suffering from Shwasa here. Bahishramanopachara, Snehanam, Svedhanam, Dhumrapanam, and Patya. That is, most of the times it is Rogochitam. Swasa Hara drugs, like you have the Abraka, Vaikranta, Shilajatu, Gandhaka, Manashila. These are the set of drugs can be given to the patient who doesn't have the illness, which can protect much of the respiratory illnesses to an individual. Also, you have the drugs of these kinds like the Yashada, Mukta Shukti, Panna, Neela, Dugdapashana, Godanti, Shanka, Tankana, Ballataka, Bhang, Vishatindukan, Vatsanaba. Swaraveda, many times the respiratory illness is associated with upper respiratory tract infections or with upper respiratory tract conditions. In those conditions, we are prescribing them with that of Snehana, Svedhana, and Shamana. Also, we are treating them with that of the Malla, Yashti. Also, we are treating them with that of the Gunja Patram, and also we are treating them with that of Kakolam. Abhyantara Shamanaushadhi, Vataja and Kshayaja, Twak Puti Mukadharana, Pittaja, Laksha Mishrana and Vasavaleha, Kafaja and Medoja, Chaturbhuja Kalpas with that of Madhu, Panchakarmopachara Vamanan Virechana, Bahashamanopachara Snehanam, Sahacharaditailam, Svedhanam, Katakari Vashpasveda, Patya Rogochitam. Similarly, Swaraveda, Prashamanam, Gunja, Swarakara, Makshika. We speak about post-tubercular or Rajekshma-like presentation with syndrome-like presentations. If you don't speak about the COVID today, even after suffering from such a long time, then we become more illogical. So on that grounds, to speak about the COVID management, this was being established during the COVID period. Like as per the stages of the illness or asymptomatic or symptomatic presentations, various combinations of drugs were being planned up to the patient. But anyway, we are with more of interest for today's presentation in post-COVID complications, wherein you might have developed with any of the complications as that of either fever, dry cough, or tiredness. Less common symptoms like aches and pains, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, a rash on the skin, or discoloration. So this is very commonly seen. Treatment protocol in general in all types of post-COVID cases. Treatment protocol could be something like assess the dhatu sarata and advise the treatment accordingly. Ojo vardaka dravyas should be given to the patient. Ayushya dravyas, rakshogna dravyas, rasayana drugs, sarva vyatihara drugs, and rudravyas or rudhya drugs can be given. Treatment of the chronic effect, later period of the COVID attacks, wherein we can give them with that of the drugs like rasayana. Shodhana, Sharira Shodhana can be decided based on the clinical presentations. Drugs based on the age of the patient can be chosen. Elders will need more Vata, Haradravya, and Rasayana set of drugs. Jara Rogagna, whenever you have the patient, seniors, these drugs can be given. Ojakshaya or Ojavardhana, whenever you have the patient suffering from Ojakshaya, then give him with Haratala, Swarna, Panna. Ayusha set of drugs, which we have already read out. Rasayana set of drugs. Most of the Rasoushadhis or Rasayana, especially the metals, minerals, everything are considered as Rasayana. And that's the reason it acts as an excellent combination of drugs as Rasayana. Similarly, Sarva Vyadihara, wherein the person lands up into syndrome-like presentations. As you see, as Rajekshma. Rajekshma is a syndrome where multiple organs, multiple systemic involvements are being involved with. So in those conditions, these are the prescriptions, textbook chapter number Shlokarapa. Rut Balyakara, Gauri Pashanan, this thing, it's very good, Vatsanaba. And also Ahifena could be manageable to the cardiac illnesses there. Rudrogahara, in case if the patient would have landed up into the cardiac disorders, then you need to give him with that of Makshika, Tutta, Naga, Navasadara, Swarna, Gula. Many times, excuse me, many times it happens like the patient here suffering from the Rudrogas ultimately land up into even the respiratory failures. So Rudroga or the cardiac illnesses and the respiratory illnesses are interrelated, and the relation between these two things is about just a management with that of the ojas and also the vata. They deteriorate both the organs, leading to multiple organ damage. Similarly, the patient is suffering from Rutshula, the patient comes to you, then these are the drugs of choices. Unfortunately, none of these things we are prescribing today to the patient. Again, the Rasayana set of drugs here. Patient presenting with that of jwara, with that of the respiratory illness, it could be dhatugata or vishama jwara, which affects all the dhatus and the shrotas most of the times seen here in the drastic illnesses. Assess the level of the infestation among the dosha dushyas and plan the treatment. In case if it's neglected, it can land up into further complications, like the patient might land up into the Jirna Jwara Avastha, patient might land up into Punarnavartaka Jwara, the patient might land up into Lina Dosha state and evolve back to the illness in future. Complications of Jwara as Atisara, leading as Jwara Atisara and other complications. Treat the patient accordingly and try to see that the patient is out of the illness as early as possible. In most of such conditions, whenever you have an infective pathology associated with that of the cardiac as well as the respiratory illness, in all those conditions, in all those patients, one of the choice of drug for me is a Mahalakshmi Vilasras. Whenever you have the patient of these kinds, wherein, see, infection is being very well evident by the clinical presentation of Jwara, because fever is a sign when the body is claiming like the person is suffering from infection or is having infections. So in any of such conditions, whenever the patient is being suffering from the infective pathology associated with the respiratory illness, then we are supposed to give him with that of Mahalakshmi Vilasras. Similarly, Jirna Jwarahara, the chronic fevers, in case you find the patient always they complain many times with bronchiectasis with secondary infections, emphysema with secondary infections, post-tubercular with secondary infections. Even this is common in post-COVID management because all of them are moving in the same boat almost, even though they are different set of disorders. Like Jirna Jwarahara, Makshika, Mukta Shukti or Godanti to be given to the patient. They are quite economical and safe drugs, can be given in most of the patients for a pretty long time. Jwaragna set of drugs, you have them. Any of the drugs can be given. Again, the Jwaragna set of drugs, which can be given in most of such conditions. Kasahara set of drugs, which can be given, like Dirgha Kalina, assess Vataja, Pittaja, or Kapaja, especially in the post-COVID conditions. It could be transformed into the Kshayaja or Kshataja Kasa in case if it is neglected here. In case if it is the complications, it lands up into Shwasahara or Shwasaroga Rajakshma, treat accordingly. So these are the Kasa set of drugs which we have already enumerated in the previous slides. Tiredness or the lethargy is a very common presentation in the post-viral conditions, wherein you need the Balya set of drugs or Angamarda Prashamana set of drugs here to the patient. So in these conditions, you need to give them with the drugs of these kinds like Abraka, Vaikranta, Makshika, Shilajatu, Tutta, Kasisa, Haratala, Hingula, Swarna, Rajata, Kantaloha, Vanga, Naga, Yashada, Mukta Shukti, Pravala, Panna, and Vajra. Either of the drugs can be given, or there is another set of drugs which can also be given to the patients of these kinds who are being suffering with the Neelam, Gomeda, Vaidurya, Spatikamani, Godanti, Shankha, Tankana, Ballataka, or Vatsanaba. Very less common symptoms are being seen as aches and pains, sore throat, diarrhea, conjunctivitis, headache, loss of taste, skin presentations, and other illnesses. Hemagarbha Potali, Panna Pishti, Makaradwaja with Purna or Purna Chandrodaya, Abrakabasma, Tapyadiloha, Amruta, Guduchi, Amalaki, and Gokshura could be the choice of drugs to most of such patients. Most of the times in the post-COVID patients or any of the chronicity of illnesses, I'm mixing up all this into one combination and I'm giving this to the patients. All this in one set. And that particular thing is being given to the patients. Prabhakaravati, it's given for a pretty long time to see that he doesn't land up into the most illnesses of the cardiac origin in future. Pravala Gulkan in case if he is non-diabetic. So these are few of the things and the interrelationship between the disorders of the Rajakshma or the respiratory illness or either of the clinical pathologies. So thank you very much for giving me this opportunity and to share few of my ideas regarding the respiratory illness or its management. And again, I would like to acknowledge the Institute Taranath Ayurvedic Medical College for making this opportunity to give me. Thank you very much. Hello.
Good evening, sir. Good evening, sir.
Namaste, namaste.
On behalf of the audience and postgraduate scholars, I found a very useful talk by Dr. M Gopikrishna, sir. It was really need when we think about management of Rajakshma-like illnesses, a thorough understanding of symptomatology along with the respiratory system as a whole. He has given a new line of thinking by Dr. M. Gopikrishna. It is true that he has quoted very useful discussions, and also he has quoted the involvement of Rudya and Balya Dravya in the management of Pranavasruta Sukaras. And the medicines what he has quoted, I hope Dr. Suresh Vivare is in the group. Very interesting that all the good speakers, good practitioners watch Dr. Gopikrishna speaking, because any line of thinking is given, the practitioner and research scholars will start their work. Of course, I know that whenever in a webinar series, all the speakers give different and untouched areas of discussion. Likewise, Dr. Gopikrishna has given a new untouched area or unexplored area of treating chronic respiratory illnesses associated with cardiac involvement, and also many other syndromes as quoted, where Kasa Pradhana, Shwasa Pradhana, and even Jwara Pradhana, where infection has to be taken in consideration. Many such clinical skills have been promoted in today's webinar. I hope much of our postgraduate scholars will make use of it and start working in this direction. And whenever needed locally, they can go and contact Dr. Gopikrishna for further discussions. Using of Rasoushadhis is inseparable part of Kaya Chikitsa, because whenever patients are there in front of us, we have to use powerful tools and very rasayana and very specific broad spectrum drugs are with Rasoushadhis combination. And I found many of the medicines explained by Dr. Gopikrishna are useful. And on behalf of administration of Tarnath Government Ayurvedic College, on behalf of our beloved principal Dr. Sayyidatar Fatima Madam, and all the faculties of Department of Kaya Chikitsa and other staff, and on behalf of postgraduate scholars, I thank you, sir. Thank you for taking your time and giving us a very good feast. Thank you once again.
Thank you, sir. Thank you very much. Please convey my thanks to Madam also.
Yes, sir. Yes, sir. Please.